My name is Barbara Cooper. I am a student at the University of Maryland Global Campus in the summer term of 2020. This project is assignment 9.1 for Professor Carrie Bean. Why is there so much coverage of COVID-19? Is this virus something to fear, or are the numbers exaggerated? Should we take extra precautions as we go about our lives, and will it help us stay healthy? What are the predictions for the upcoming months? Will this virus flatten out and go away, or are we stuck with it and the risks that it brings? Where in the world is COVID-19? In Figure 1, you can see the United States is at a global high of 3.7 million cases as of July 13th, with over 140,000 deaths. Brazil is in the middle of the pack, in yellow, with just over 2 million cases. And in South Africa, they are among the lowest number of cases to date, with just over 350,000. This map shows how COVID-19 has infected nearly every single country in the world. So what are governments doing to protect us, and which countries are implementing stricter measures to protect citizens? Figure 2 shows the Government Response Stringency Index, which factors in indicators from countries including school closures, restrictions in going out in public, economic policies to help people financially, and health system policies such as access and requirements of testing. The scale for this ranges from 0 to 100, with 100 being the strictest. As you can see, the index value for both France and Italy was over 90, meaning they implemented strict measures as a response to the outbreak, and they report smaller numbers as a result, with France reporting 172,377 cases, and Italy had 242,827 cases. If you look at the US in contrast, we have the highest number of cases with over 2.8 million, and the lowest index of the countries on the graph with a 73. This graph shows that following the guidelines set out by the CDC helps to protect everyone. How many people are getting sick enough to need to go to the hospital? Figure 3 shows the hospital beds available per 1,000 people by country. This measures an overall indicator of how many hospital resources might be available to people with serious illnesses that require hospitalization. If not enough beds are available, then it is more likely that contagious diseases will spread, since people don't have adequate resources to doctors. Thus, the mortality rate will go up. Figure 4 illustrates the share of the population by country with basic hand washing facilities on premise as collected by the United Nations Statistics Division. The UN has promoted good hygiene as an important method to contain the spread of contagious diseases, including COVID-19. According to the UN, providing more access to hand washing settings in places like hospitals will reduce the number of infections and improve mortality. Proper facilities include private bathrooms with clean running water, sinks, and soap. The dark blue areas are countries with more access to hand washing stations, whereas darker green areas do not have easy access to practice good hygiene. An example is Egypt, in dark blue, who reports 89% of the population have access to wash their hands, whereas Bolivia is reporting only 25% have good access to wash their hands. Figure 5 is the forecast concerning COVID-19 for the foreseeable future, as the number of new cases is predicted to continue to rise globally, and the number of new tests administered will continue to rise as well. But the forecast is predicting that the number of people dying from COVID-19 will level off in the next 3 months. Based upon this analysis, COVID-19 cases are going to continue to rise, which means fewer hospital beds for the sick, and the number of deaths will increase in the next few months, although it is leveling off. Things that we can do to help flatten the curve of people who catch the virus is to practice good hygiene by washing hands frequently and wearing masks in public. The CDC maintains that practicing a social distance of 6 feet will help keep you apart from others to limit your exposure to the virus. Governments around the world have implemented varying degrees of closures of businesses and schools to help reduce the number who get sick. This is a global pandemic that is only going to get worse before it gets better, so following the guidelines recommended by experts is our best chance to stay healthy.